Hi, I'm Dr. Ron Rigby of Ogden Clinic. Today we're going to talk about another aspect of trying to improve your optimal health. The way I look at it, we're trying to get all these different systems, different hormones, communication aspects to line up, and there's multiple different factors that can play a role. I always focus on the insulin first, but it's not the only factor that plays a role. Today we're going to talk a little bit more about thyroid and more of hypothyroid. We're not going to go into the whole aspect of the hypothyroid in and of itself, but just kind of the complexity of thyroid function by itself. So what happens basically is the pituitary gland, it's a gland that sits between your eyes and releases multiple different hormones, releases a hormone we call the thyroid stimulating hormone, which travels through the whole body, but it has the receptors here on the thyroid, which is a butterfly gland right in front of your throat. And that gland releases a couple different hormones, actually 4 particularly. You've got T1, T2, which it says they're pretty inactive. They're there, they have a little bit of function, but not enough that we're going to worry about right now. Then you have T3 and T4. So T3 has the most of the activity, but T4 is the majority of what comes out of the thyroid. And as you can follow our dotted lines, actually is a precursor to making T3, which is the active form. And that's where we need to focus on. However, a lot of times when you have your lab work done, most providers, and we're taught to just check the TSH, and if that's in the normal range, then we don't have to worry about it. Unfortunately, it's not that simple, so we need to dig a little bit deeper, especially if you're having some of the symptoms. And for some of that, watch our next video or another video about hypothyroid. Right now, we're just talking about the general function of the thyroid. So T3 being the more active one, with that, we actually have a couple different aspects. We've got free T3, which is actually what can go and affect the receptors, and we look at a percentage called T3 uptake. This is actually a percentage, and normal can go from about 24 to 39%. Different labs will have different values, and in fact, some labs don't even run this anymore. It's kind of the idea that it's an old test, we don't need to worry about it, but it's actually needed to look at the function of the thyroid. But coming back to the T3 part, we have basically 3 different parts. We have the free T3. If you remember from other videos, we usually have a free and a bound. The bound is bound up and carried around, but it's not active. The free part is what's effective and can go affect those receptors. But when I said there's 3 parts, the free, the bound, but we also have what they call the reverse T3, which has similar structure, but where the location of the iodine is a little bit different. So one way of thinking about it is the free T3 is like the accelerator or the gas of your car, make things move forward. Where reverse T3 is almost like the brake. And yes, if you have high brake and high gas, you're not going very far. Now, we don't want just all high gas. We want to be able to control things, but we want to focus on more of the active form of the thyroid and trying to get those levels up. And if you've watched other videos, I always talk about when we look at labs, we always say it's in the normal range. Well, how do we determine the normal range for both TSH, the T4, the T3, the free T3, even the T3 uptake, and even the reverse T3, is we're checking masses of people. The young, when I say young, I'm talking like young adults, late teens, early 20s. Old, I always use 80 plus, but as long as you're around and you're going to the doctor, theoretically that's going to be in the group of people we're testing. You've got males and females, and sick and unsick. Well, if you remember who usually goes to the doctor and who's getting lab work done to look at things, it's usually the sick people. So I jokingly say when doctors say you're in the normal range, you're normal for an average sick person. That's not being optimal. We want you to feel better and function better, so we might have to get you a different range. That range can be lower or it could be higher. Depends on the test. And that's where having a discussion with your provider, if you're still having symptoms, what's going on? What can we do? We've got to improve it. So Again, keeping in mind when you go to a provider and ask for your thyroid, you need to ask them for the whole thing. But a lot of times, this is what we're taught to do. That's what I used to do in the past. So this is not against them. This is what we're taught to do. And if this is normal, that's all we have to look at. No, that's only looking to give us an idea of primary hypothyroid. So again, watch future or other videos to get a better idea about what that is and what the categories are. But we want to look at the whole cascade of the process to try to get the body to function well. And one thing I didn't put on this image, but how that active form now actually goes back and tells the body how effective we are. So it's a kind of a loop system. We're looking at the downward part, but we need to look at, again, if we're struggling, could the feedback be part of it also? Yes. So keeping in mind, thyroid's not as simple as we always say it is. It can be pretty complex. We need to go a little bit deeper, especially if you feel like you have some of those symptoms. Our goal is to help you feel better and have better optimal health. My call to action for you is, if you feel like you have some problems, get the lab work done. Ask for the lab work, and if they say no, again, be your own advocate and kind of push forward a little bit. Again, we need to get you to feel better and function better.